hypothyroidism. Now, of course, it is manageable, it is treatable. First of all, we must achieve a diagnosis. So at first, we must decipher that it is a thyroid condition. A lot of times, thyroid conditions are missed. In fact, more often than not, patients are treated for other things rather than the thyroid condition, especially if there is no neck swelling. So the first thing is to arrive at a diagnosis. There are clinical reviews that are done. We take the history of the patient. We get to know some of the things happening, like the symptoms we mentioned, whether the person is breathless, the person is heat intolerant or cold intolerant, the person has increased appetite or decreased appetite, and so on. Those actually begin to give us pointers to a condition. And the next thing is to do a physical examination. So this is done in the hospital. We try to check right from the eye. The eyes also give us symptoms of thyroid condition. We check the neck, which is the neck mass. We try to check to see, is this simple increase in hormone, or in fact, is this some form of a tumor of the thyroid gland? So it's sometimes beyond just increases in hormone. Sometimes it could be a tumor. There are other conditions that we may not bother to get into, but some of them actually are beyond just the increases in hormone. So we check that. And then we check also the heart. We check the chest generally, and that's where we find the heart. We may find increases in heart rate, and therefore the person already would have complained of shortness of breath or easy fatigability. And then we may check to still see other things. There may be some excessive sweating. So we may see that even while examining the person is sweating. That may still be a symptom of hyperthyroidism. And then we check the legs. It's what we call pretibial mixed edema. Some swelling around the front of the ankle. Again, that's some pointer to symptoms of thyroid gland. So yes, those are physical examinations. So once we begin to point towards those things and we think we are convinced that there is a thyroid condition, we want to go on with lab investigations. So we want to take blood sample to check the level of those hormones. Like I mentioned, the TSH, the thyroid stimulating hormone, we either find it to be normal, low, or high. That again begins to tell us what's happening. But at the same time, the investigations want to check for T4 or T3. These are hormones that are secreted by the thyroid gland. Their levels correlated with the level of the TSH give us a ground to decide what kind of condition that is. It could either be, one, a hyperthyroidism, two, a hypothyroidic case, or three, thyroid nodule. Now, that means it may not necessarily be that it's just a case of raised hormone. Like I said, it may be a swelling that sometimes could be cancerous. Now, there are other things that could be done like thyroid scan. Now, that's not so common in our climb here. Iodine scan is something that's done and that's very definitive and gives us exactly the level of activity of the thyroid gland, and we could arrive at a diagnosis. Sometimes some recommend some biopsy, especially when there is a high index of suspicion. That means when we think that this is not just increase in hormone, there could be something sinister. So there could be some level of biopsy. And after that, decision is taken. Now, if it is just a simple thing about the hormone, that we realize that the thyroid hormones are high, we want to slow down the excessive secretion of thyroid hormone in hyperthyroidism.